Good evening, everyone. I want to thank you for coming to Queen's Free Speaking of Health lecture series. Tonight's lecture is called Caregiver Stress, What You Should Know. My name is Lisa Sakia, and I'm with Corporate Communications here at the Queen's Health Systems, and on behalf of Queen's, I welcome you all this evening. It is really wonderful to see you here because I know maybe right now you're taking time off from being a caregiver. Hopefully tonight, with the information, with the experiences that are going to be shared, you can find a little bit of hope, a little bit of respite just by being here this evening. Okay, at this time, it is my pleasure and privilege to introduce you to our first and main speaker this evening, Dr. Jessica Barry, a geriatrician here at Queen's Medical Center. If I could have you stand. Dr. Barry was born and raised in Kansas, and everyone always wants to know, what high school you went. So she went to Lawrence High in Lawrence, Kansas. Anyone? How about Kansas? Anyone been to Kansas? Yay! Oh, Lawrence, someone screamed Lawrence, all right. But her husband went to Mid-Pacific Institute, as you know, the greatest school in the world, and my alma mater. Dr. Barry, she attended the University of Kansas, where she got her Bachelor's of Arts in Chemistry. She received her medical degree from the University of Kansas Medical School. She did her internal medicine residency at Brown University in Rhode Island, and followed that up with a geriatric medicine fellowship at the University of Hawaii. She is currently an assistant clinical professor in the geriatrics department at the University of Hawaii. And please join me in welcoming her, Dr. Jessica Barry.
Okay, I'm short, so I have to move it down, and I even have heels on. Well, thank you all very much for coming. Let me get this started, and then we will start chatting. Okay, so this is a fabulous quotation from Rosalind Carter, who actually has the Rosalind Carter Foundation on Caregiving. And I absolutely love this because I really think this drives home where all of us are at in our life. There are only 4 kinds of people in the world: those who've been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. All of us are going to be in these categories throughout our life, and today we're going to talk about being a caregiver to somebody that you love. I'm going to come back to this many, many times. This is my broken record. Those of you who see me in the clinic know that I am notorious for being a broken record because I think that the more we hear it, the more likely it is to sink in. I don't know what I'm going to do when I give this lecture in 30 years because nobody's going to know what a broken record is. But I'm hoping we all do tonight. Okay, so these are my key points and things that I think everybody needs to take away from this evening. One is that when you are a caregiver, you need to have patience. You need to have patience for the person you're caring, and you need to have patience with yourself because you are going to mess up, and you need to forgive yourself, and you need to be patient with your learning and with the times that things don't go perfectly. Everybody who's a caregiver needs respite. Everybody who's a caregiver needs time away. Everybody who's a caregiver needs support. And as I mentioned, everybody who's a caregiver needs to have forgiveness to themselves and forgiveness to the person they're looking after. So what is a caregiver? I think most of us think about a caregiver as somebody who's taking care of their loved one who's in a wheelchair or who is in a bed. But that may not be the caregiver that you are or the caregiver that your loved one needs. It may be a next door neighbor who comes by every day just to make sure that their neighbor is eating, just to make sure that, somebody's auntie or uncle is actually taking their pills. Maybe they come by once a week and set up a pill box. That person, in a way, is a caregiver. It may be a spouse or a child who's actually doing the hands-on personal care. It may be the person who is literally spoon-feeding somebody. It may be someone who's actually changing Depends and changing diapers in bed. But basically, if you're helping out with somebody who needs help on a regular basis, you are a caregiver. So let's talk about why this is so important and why we're here. It's because we're getting older, and in Hawaii, we're getting older so much faster than even on the mainland. In the US, there's about 46 million people who are 65 and older, and in Hawaii alone, there's about 200,000. And in the next 40 years, the number of people 65 and older is going to double. Currently in the state of Hawaii, because we have such a large population of people who live very, very long, we live the longest of any state out there, that population of people 65 and older is growing 4 times as fast as younger people. So what the takeaway here is that as we get older, there's going to be less young people to care for us. Currently, there's about 3 caregivers for every senior, and in 30 years, it's going to be 2 caregivers for every senior. So this is going to be a bigger issue as our population gets older. This is that silver tsunami, which is my little wave there, that everybody talks about. It's about getting older and not having as many young people who are kind of following up behind us. This is a bit of the legacy of baby boomers. So keeping in mind that about half of all Americans have just any chronic medical condition, that can be diabetes or blood pressure or heart disease, people who have chronic medical conditions are more likely to develop memory diseases and dementia. And just with Alzheimer's alone, there's about 5 million people out there, and about 27,000 here in the state of Hawaii who have dementia. I'll be really honest, that number is probably higher. It's probably higher than 27,000 because there's a lot of people out there who've never been diagnosed with dementia. Of these 27,000, there's 64,000 people looking after them. So this is that kind of 3 to 1 that we're talking about. This one's a little closer to 2 to 1. But these 64,000 people provide 27 million hours of caregiving. Inconceivable. This is a full-time job. So let's talk about dementia. Being a caregiver can include any sort of disease, but we're going to specifically talk about dementia because that's the patient population that I take care of. Dementia is a general term for any type of disease that causes brain damage. And it affects somebody's memory, like we normally think about forgetfulness. It also affects somebody's thinking ability, their ability to make safe and wise decisions, and their ability to look after themselves. And that's why this is so important. So dementia is a very broad category. It includes all different types of diseases. It includes Alzheimer's disease, which is the most common, vascular dementia, which is memory disease because of strokes, dementia for people who have Parkinson's disease. There's another couple types of dementia that are a little bit less common, Lewy body disease and frontotemporal. So there's lots of different dementias out there, and that's one of the reasons to come see a geriatrician, so you get the proper diagnosis so that you can be treated appropriately. So talking about the stages of dementia, because what stage a person in gives us an idea of how much help they really need. So for mild dementia, people have some short-term memory loss. And this isn't the normal memory loss of where's my keys, where's my glasses, that's normal, that happens to all of us. This is short-term memory loss, like you can't pay your bills because you can't keep track of when your bills are due or where your checkbook is at, or did you already pay the bill? Did you forget to sign the check that you put in the envelope that you put out? This is problems driving, and not just like where I left my car, because we've all lost our car. Everybody has lost their car in the garage at Honolulu Airport. I had to have security help me find it once. Probably shouldn't admit that for so many people. This is problems driving where you get lost going to familiar places. Problems taking your medicines. When you actually think about it, it can be very complicated to take your medicines if your short-term memory isn't so good. So imagine that you're starting to open up your pill box and take your pill, and then you get sidetracked by the phone ringing and you forget to take your pill, and you go back and don't realize that you haven't taken it. You put the cap back on and you go about your day. This is also when people need help with things like housekeeping and cooking. So moderate dementia is when you have more short-term and long-term memory problems. And this is when people are needing a lot more help with day-to-day activities like bathing and dressing. So this may be simple, Mom, did you take a shower today? I don't think you took a shower today. Please take a shower today. Or actually needing help washing hair, washing back, making sure that it's a good clean. Severe dementia is when people need help with basically all what we call activities of daily living. So this is not just bathing and dressing, this is going to the bathroom, this is maybe feeding themselves, needing help, wiping when they go to the bathroom, needing help pulling their pants up when they go to the bathroom, that kind of thing. And then end stage is when people are either bed or wheelchair bound and they're not really saying much beyond a few words. They're having recurrent infections, they're having recurrent bed sores, and this is just because their body is giving out as they're getting close to passing away from their dementia. This is also very commonly when people have swallowing problems, when people are having something called aspiration, where food and fluid is going into the lungs. So when does somebody need help? Whenever there's a health or a safety issue, and it needs to be addressed regularly. So when I meet somebody in my clinic the first time, I talk about how things are going. How are the medicines going? How is the bill paying going? Have you had any accidents when you're driving? And if everything's going okay, truthfully, if everything's going okay, they probably don't have dementia. But if they're having a little bit of problems and the family is helping out, the family is taking care of bills and taking care of medicines, then I say, don't change a thing, leave everything as is. But it needs to be checked on regularly. Every time somebody comes in, I'm going to ask, are you having any problems with your medicine? Is it time to start a pill box? This is a great time to have family come and help somebody set up a pill box. So we have the patient and the family member together set up a pill box, and then the family member will check the pill box on a regular basis to make sure that things are being taken correctly. In early dementia, this isn't a 24-hour-a-day caregiver. This is somebody who is stopping in several times a week or maybe lives with them, but is still, the family member is still going to work, the loved one is still at home by themselves throughout the day. But as dementia worsens, as we talked about in the different stages, you're going to need more help as time goes on. Everybody with dementia, if they live long enough, is going to need 24-hour-a-day supervision and care. No time alone, because they're not going to be safe. They're not going to be able to do the things to keep their health and safety intact. So that's one of the reasons that we're here, is so that we can talk about planning for down the road. We can talk about the things that everybody needs to do to make sure that their loved one is as healthy and as safe as we can possibly make them. So I don't know if this was one of the flyers outside about the 10 warning signs of caregiver stress, but I thought this was a really good summary of what caregivers need to look for in themselves, because these are signs that you need help. These are signs that things are not going well and you need to ask for help and support. Denial. Denial in yourself, not in the person with dementia, because actually now is probably a good time to mention that people with dementia don't know they have dementia, and it's not denial. It's a true inability to know that they have dementia. So we can tell them all day long they have dementia and they're forgetful and they're wrong. They're not going to believe us. So stop telling them that truthfully, because it's going to make everybody better. But people with dementia, people who are caregivers to those who have dementia may be in denial about the limitations of their loved one because of the disease. And they might be angry and frustrated at that loved one because of the limitations of that disease. And inevitably, when you're under stress, what do all of us do? We withdraw. We don't spend time with friends and family. The types of activities that are going to make us healthier, the types of activities that are going to give us support, we're going to stop doing. We're going to be anxious. We're going to be depressed. And then, because this is how this always works, you're irritable, you're exhausted, you can't sleep, and everything is getting worse. And then you don't go to the doctor because you don't have the help that you need so that you can walk away from your loved one for an hour or two to go to the doctor to take care of yourself. And then you end up with all the health consequences of not taking care of your own personal health. So, what do you need to do if you're a caregiver? You need to take care of yourself. You need to go to the doctor. You need time to yourself. You need to find humor and joy wherever you can. Even if it doesn't seem like it should be funny, if something strikes you humorous, as long as your loved one isn't going to be upset that you're laughing, find humor in the little things. Find humor in living in the moment. They say that people who live with dementia live in the moment. They don't have a future that they can plan. They live in the moment. So enjoy the humor, enjoy the joy that you can find in the moment. People with dementia frequently have behavioral issues. Anger, temper, hitting, hallucinations, delusions. Don't take it personally. I know that's a really hard thing in the moment when your loved one, who's always been the kindest, sweetest person on the entire planet, is cursing you out. Don't take it personally. That is brain damage. That is their disease. Try to be forgiving of that person. Use music therapy. Music is stored in a different part of the brain, so people remember music from their youth like, childhood, teenage years, longer than just about anything else on the planet. So I have this fabulous patient who hadn't been doing very well for a while and was really sleepy all day long, dozing in and out of cat naps, and she was staying awake all night, and it was driving her care home operator batty, truthfully, because she was staying awake all night because she was sleeping all day. So she comes into the visit, and I pull out my phone, and I'm like, let's play some music. I look at her date of birth, and I think, okay, well, we're looking like big band type music. And I actually went online and found what like the top 5 songs of, when she was like 16 years old was, and it was big band music. So I go on and I play some big band music, and she wakes up and is alert. And I say, do you know this song? And she smiles at me and says, no. But she was awake, and she was awake for the first time in that entire appointment. And so I told the caregiver, talk to the kids and find out what she listened to, what they remember listening to when they were little that she would play, because she's clearly responding to it. I like the big band music. Anyhow, talking about behaviors, again, anxiety and depression is part of dementia. It's part of the disease. It doesn't happen to everybody, but it happens very commonly. And please remember that it's not somebody, being stubborn. It's not somebody being hard-headed. It's part of the dementia. And also accepting help and even placing somebody into like a care home or a foster home or a nursing home, it's not failure. It is doing the right thing for the person that you love to make sure that they are healthy and safe. And I tell this to people all the time, and I think this is also one of the most important things, is one person can't do it all. One person cannot be a caregiver 24 hours a day, 7 days a week, and still provide good care for themselves and provide good care for their loved one. You have to ask for help. And that may be help that you're paying for, and it may be help from friends and family, and we'll talk more about that. So what can you do to look after yourself? You need to find out what community resources are available. So this is one of the reasons we have people out in the waiting area talking about what resources are available. And you need to find help. You need to find support. You need to find something that relaxes you. You need to exercise. We all know, we don't all follow it, but we all know that you're supposed to exercise for good health. Part of that is to reduce your stress. And you need respite time. You need to have time for yourself, time away from being a caregiver, time just to be who you're supposed to be outside of a caregiver. And you need to come to things like this, or the Alzheimer's Association, where you can learn about the disease so that you can cope better. And unfortunately, one of the things that we all need to do, and it doesn't matter what age we are, after about the age of 18, we all need to make legal and financial plans for, that rainy day, for that day that we need more help and that we need to make decisions when it's uncomfortable, when people are not doing well. I thought this was really funny. Every time you find some humor in a difficult situation, you win. I have a daughter of a patient who was telling me that I think it was her cousin looks after her mom who has dementia. And what she decided to do every time her mom was getting cantankerous with like personal care, wiping after bowel movement or taking a shower, that kind of thing, she was going to sing all of her instructions to her. And when she started singing all of her instructions, she found that she couldn't be cranky, she couldn't be angry, and then her mom wasn't cranky and her mom wasn't angry, and everything went better. So trying to find the humor, trying to find the lightness in a situation can really make everybody's life better. But there's going to be times that things don't go so well. And everybody is allowed an occasional meltdown. And I tell my family members and my caregivers that if you get to the point where things are escalating, as long as your family member, your loved one is safe, leave the room. If you need to go to your bedroom and scream into a pillow, that's fine. If you need to go outside and garden for a little while, that's fine. Just make sure your loved one's safe. As long as they're safe, have that meltdown. Call somebody. Call the 1-800 number that the Alzheimer's Association has in case of emergencies just like this, where you need advice right then and there. But take that time to have the meltdown, because probably you're going to come back with a little bit better energy than if you hadn't had the meltdown. So when do people usually ask for help? Most commonly, it's one of these 3 things. It's behavioral issues, incontinence, or sleep problems. Behavioral issues frequently has to do with simply the changes in the brain because of dementia. And it may just be a simple thing like miscommunication. Somebody with dementia may not be able to understand what they're being told. Someone with dementia may not be able to communicate out their wants and their needs. Sometimes behavioral issues are because you're frustrated. I tell people, if you get told the same question over and over again, like, where are we going to dinner tonight? And then you tell them, where are we going to dinner tonight? And you tell them, where are we going to dinner tonight? And you tell them. And the 15th time, you're like, I've told you 15 times we're going to dinner at blah, 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 blah. And the poor person who has no short-term memory goes, why are you yelling at me out of the blue? And then everything escalates. So this is when we have to be patient. This is when we have to forgive ourselves, because this is going to happen. And this is when you need to realize that maybe taking a break for a minute is a good idea, and that can help with behaviors. Again, another reason people frequently ask for help is incontinence. It's really tough to take care of an elder who can't hold their urine, can't hold their bowel movements, that needs to wear Depends, needs to wear a diaper. That takes a lot of physical manpower. And if you have a husband who maybe weighs 170 pounds and the wife is literally 85 pounds and she's trying to change him, she may not physically be able to do that. And then sleep issues. Nobody is healthy. Nobody is happy if they're sleeping poorly. So this is actually a really common reason that people ask for help, because they need to get sleep for their own health's sake. So just to kind of talk about redirection and reassurance and other things that we can do about behaviors, because I think this is a really important topic. Because again, this is one of the things people complain about. Well, complain's not the right word. People bring up the most. I don't want to say complain, because these are valid concerns. These are things that would make anybody ask for help and make anybody stressed out. So when behavioral issues happen, the things that we recommend is redirection. Changing the story, changing the conversation, changing the room, getting people out of the house, reorienting people. Sometimes you hear, when are we going to go home? Well, Dad, you are home. No, when are we going to go to my house? This is your house. You've been living here for 20 years. But if you don't have a good short-term memory and you're remembering back 40 years, you're remembering back a house from 40 years ago. So sometimes the answer is, no, we moved here not too long ago. This is our new house. We live here now. And if that's the right answer for that person, they go, oh, okay. Sometimes that doesn't work, and you go, oh, we can't go home now. We'll go home in a little while. And that's when, changing the subject completely is worthwhile. One of our caregivers who's going to talk this evening has really shown me the power of a snack. When her dad gets, and I remember this from nearly the beginning when you came to see us, when her dad gets agitated, she pulls out a crustless is it peanut butter and jelly or just peanut butter? Okay, peanut butter and jelly sandwich. And he settles down. He eats a sandwich and he's completely content. It's amazing, the power of peanut butter and jelly sandwich. Pain control. So if you're in pain, you're going to be agitated. Doesn't matter if you have dementia. It doesn't matter if you're 4. If you're in pain, you're agitated. And so treating pain can help. It's amazing how one Tylenol arthritis can solve a lot of problems. Pet therapy. I think a lot of us do really well when we have a dog or a cat around. Time toileting is what we call when people have problems with their urine, people have problems with their bowel movement, and we make them go to the bathroom more often. So sometimes people feel an urgency to go to the bathroom, and if we get them to the bathroom more often, they don't feel that urgency, and then they don't feel that agitation that comes along with having the urgency to go to the bathroom. And I always tell people constipation control is so important, because when you're a senior, constipation affects you from the top of the head to the tip of your toes. It causes balance problems. It causes not just belly issues, but nausea and not feeling well, in general not feeling well, not just stomach feeling well. It can actually cause people to be agitated. It can cause people not to sleep well. So if you get the bowel movements going, people actually do better and feel better overall. And then as much as we want to help with medicines for anxiety and for sleep, it's best to avoid these. And these include everything from Benadryl or Tylenol PM or Excedrin PM, because the PM is Benadryl. Medicines like benzodiazepines, it's in the family of Valium. And most prescription sleeping medicines, because they actually make memory worse, they make thinking worse, they make balance worse, they increase risk of falls. So as much as you want to give something like that to comfort your loved one, you're better giving Tylenol and talking to their doctor about what medicine is right for them. So this is one of the things I tell people all the time in my clinic. Is it a health or safety issue? If it's not, let it go. It is not worth an argument. It is not worth the discussion. Let it go. Okay, so coming back to my key points, because this is, again, what I want you to take away from tonight, if nothing else. Please be patient. Please be patient with yourself. Please be patient with your loved one. Please have support. Please take time away, and please forgive your loved one and yourself when things don't go well. Okay, you think I'm done, but I'm not. I'm going to come back to that slide one more time. Okay, so why is it important to get help when you're a caregiver? If you are a stressed caregiver, it takes a huge toll on your health. You have a higher chance of getting an infection. If you have a wound, it's not going to heal as fast. If, heaven forbid, you have cancer, your cancer is going to get worse faster. It shortens chromosome telomeres. You don't need to remember this, but basically what this means is that your chromosomes, your DNA, is aging faster. Increases your risk of high blood pressure, increases the risk of a fast heart rate, increases the risk that you yourself are going to get depressed. And as I kind of mentioned, you don't look after yourself. You don't take your medicines, you don't see your doctor, you don't sleep well, you don't eat well, and you're not exercising. So there's a lot of health consequences when you're a stressed caregiver. So where can you turn? Well, one, lectures like this. There's also Queen's Geriatric Services, which is the department in which I'm at. And that's full of geriatricians, geriatric nurse practitioners, and we talk to people about things like this. We do dementia assessments. We have people come in and find out about their memory problems. And what we really like when people comes in, we want their family member to come in too, because we want to check in with them and see how they're doing. The Alzheimer's Association is absolutely probably the best resource out there, I would say. They have caregiver classes, they have support groups, they have so much information that they want to pass on to you. And that's local, and that's all over the island in different times and different locations. The Alzheimer's Association, as I mentioned, does have a 24-hour kind of hotline in case you need help in the middle of the night and you don't know who to turn. That's who you can call. There is also Project Donna and Catholic Charities. They have all sorts of varied services for people. Project Donna has a Caring for the Caregiver support group, which I've sat in on the Alzheimer's Association support groups. I've not been to the Project Donna one, but I've heard that it's fabulous. Elderly Affairs, which is a city and county department, is a really great place to start when you kind of don't know where to start. You call up, you tell them the situation, and they will help guide you to the right organizations and help guide you to find the right resources that are out there. And then Kapiolani Community College actually puts senior classes for caregivers called the Kapuna Education Center. So talking about in-home help, we're going to kind of talk a little bit about what help is out there in general. There's everything from, having friends and family to hiring caregivers, and that can be something like an agency. So you're going to actually be paying a little bit more because these people have gone through background checks. They've had verified experience, verified education, to having non-agency caregivers. So this is somebody that, word of mouth. You find somebody from church, you find somebody on Craigslist. Be very careful unless you have a very, very good reference because you don't know about that person. Home health services are out there. Home health services primarily are for people who need a skilled service. So that's like nursing, like an RN nursing care, like wound care, or physical therapy in the house. And those are typically covered by insurance for a period of time. And then there's supportive care service and hospice service. And supportive care service is with the hospice companies for people who are not in the 6-month end of life that what hospice is, but getting toward the end of their life. And so it's an extra service that's free that helps basically manage chronic conditions in the home when people aren't quite at hospice stage, they're not quite at the last 6 months of their life, but they're needing a lot more personal in-house care. And that's usually like a nurse 1 or 2 times a week, and like bathing aids, kind of similar services to what hospice has. Outside the home, so this is somebody who wants to live at home but needs help. So maybe your parent, you go to work all day, you need somebody to go somewhere. So like adult daycare, adult day health. These are fabulous places that your loved one can go, be very busy. It's full of activities, it's full of exercise classes, and it's full of food. So people usually like it. I have a video, and we won't watch the whole thing because I think it's something like 5 minutes. But this is
living independently at home.
This is from the National Institute of Aging.
Would like to do as long as they can.
But I think it's just kind of a good
Senior
example of
centers,
what is daycare. So this is an adult daycare.
Transportation and meals programs are long-term care services available in the community, which make it easier for older adults to remain in their homes.
I just want you to kind of have an idea of what an adult daycare looks like.
Adult daycare
so I'm going to kind of talk over it, quite honestly.
Social and other services for
adult
adults
daycares,
with mental or physical impairments.
You pay out of pocket for unless you have long-term care insurance, but it's a really good place for people to stay active and to exercise.
Individuals usually go to adult daycare when they
If I had one
can't stay
thing that
on
I
their
could
own
say about
home.
adult daycares is it is absolutely something that you need to investigate. Let's see if I did get all the way back. Oh, and then I went too far. It's something you have to investigate because there are adult daycares where all the seniors are very frail and very ill, and there's no real conversation going on. There are adult daycares where people are actually pretty healthy, and there's all sorts of conversations going on and all sorts of activities. And you have to find the right fit for your loved one, or it's not going to be worthwhile for them. If you have a loved one who can still hold a really great conversation and can really participate in activities, don't send them to one where everybody else is very frail and very quiet, because they're not going to get anything out of it. Adult day health is like an adult daycare, but they're able to do more. They're able to do more like personal care, like helping with toileting. They're also able to give medications if need be. If you're looking at something like an adult daycare and adult day health, think about handy van. So basically you need to be at home when your loved one gets on the van. It's a curbside to curbside visit, or curbside to curbside ride. So they'll drop them off at the curbside of the daycare. They walk inside, do the ride home. Dirt cheap. Some people are able to fit it into their schedule. They can give rides to their loved ones. But handy van is a really great service if you can't. And then respite care. So respite care is just a short stay somewhere, and that may be in a care home, it may be in a nursing home, but it's a temporary stay, and then you get to come back. So VA does this actually. It's a VA benefit for veterans who qualify, and I think it's 10 days? 10 to 30 days a year. So that's something that the VA could benefit, but only for veterans. Okay, placement. So I think this is the most important thing on this slide is placement is not failure. You're doing what's right for your loved one. If you have your loved one move into an assisted living or a care home or a foster home, you get to be your loved one's child or spouse. You don't have to be their caregiver anymore. So this means when you go, you just get to enjoy their company. You don't have to be the one nagging them to drink 8 cups of water a day. You don't have to be the one nagging them to get up and take a shower. You're paying the caregiver for that. So what do? You get to bring photo albums and go through photo albums from when you were young. You get to go there and bring favorite foods. You get to have fun again. You get to be family again. So it's not a failure. You're doing the right thing for your loved one. So just to talk real quick about what everything is, independent living is basically a full apartment in an assisted living. So you have a full kitchen, you can have a studio, you can have a 3-bedroom. They will help with like 1 meal a day. They'll have rides for you, but it's basically like living in an apartment in a senior complex. Assisted living is when you have like a small kitchen, no burner, no oven, maybe a microwave, maybe coffee maker. You get to go for 3 meals a day. The nursing staff checks your blood pressure. They give you your medicines. You get a lot more intensive care. And then care home is what we're very commonly familiar with here in Hawaii. And that's because we have a shortage of assisted livings and nursing homes, quite honestly, though we're getting a lot more assisted livings in recent years. So care homes usually is a private home. Usually it's an individual's personal home that they've opened up and they're licensed to look after anywhere from 2 to 5 people. And it's primarily people who are, majority of whom are actually need just a little bit of help, bathing, dressing, that kind of thing, but not a whole heck of a lot more help. People who are in expanded care homes or foster homes need a lot of help. So they may even be bedbound. They may not be able to walk. And then nursing homes here in the state of Hawaii is really for kind of the frailest of the frail and the sickest of the sick. So people who really are not walking, people who are wheelchair and bedbound. Here, most people don't end up moving into nursing homes. Most people end up moving into care homes, expanded care homes, and foster homes. And then just a side note about skilled nursing. Skilled nursing is an insurance benefit for people who spend 72 hours in the hospital and then have some sort of like nursing need or physical therapy need that can only be met in a skilled nursing facility. So I'm just going to show a couple of videos. I found this great video online of an assisted living. It showed you what the lobby looked like. It was a place in like California, I think. Showed you what a lobby looked like, showed you all the services they had. It showed you how absolutely wonderful the rooms and the meals and everything was. But I picked this one instead, and you'll see why. And I am going to make you watch the whole thing because this is adorable. So this is on the mainland somewhere. I don't even know where, but this is a typical assisted living. Apartments. So you're seeing people in hallways in their apartments, and then there's dining, there's meals included. But there you can see everybody's apartment. And you also see how varied people's health are. And yeah, I don't know why he's like polishing the carpet. Dings for running over on my time because I made you watch this video.
No offense to you, don't waste your time. Here's why.
Assisted living could be very homey. They really become people's homes. Like hair salons in them too, so you don't have to go anywhere to get your hair done.
Beautiful blue eye, I won't fall in the ice again.
Okay, I couldn't help it. Okay, this, we won't watch the whole thing of this, but this is a care home. This is, again, a care home from the mainland, and I blatantly stole this off the internet, I'm not going to lie. But this also gives you an idea of what a care home looks like. And this is actually a really typical care home. I've done house calls, and this, you would find this here on Oahu. So communal dining, everybody sits together for meals. Obviously big kitchen, because they're going to be providing meals from anywhere from 2 to 5 people. Okay, I think that's the other video running in the background. Yeah, sure was. Sorry about that. But nice outdoor spaces, places that are enclosed. So seniors who are forgetful can go outside, but we don't have to worry about wandering, don't have to worry about people going where they shouldn't. Again, big communal areas, big places where people can sit down, do activities, do exercises, watch some TV. And again, this is much like an adult daycare or an adult day health. You have to find the right care home for your loved one. You have to find the one that you think your loved one would fit well into, and that's the best one for them. Okay. I've learned my lesson. I will stop all these other ones. Okay. Okay, so just so we have an idea of where everything costs, it's very, very, very variable. In-home care, so this is a agency, private caregiver, anywhere from about $25 to $30 an hour, and it's about a 3-hour minimum. That's what most of the agencies have. If you're looking at something like adult day care or adult day health, you're looking at $80 to $95 a day. An assisted living, so this isn't the independent living, this is more the assisted living side, is $4,000 a month or more. A care home or a foster home is anywhere from $2,000 to over $10,000 a month, and a nursing home is well over $10,000 a month. So who pays for this? Well, it depends in part on your finances. If you have a lot of money, the government wants you to pay for it. The only exception to that is that skilled nursing we talked about. If you've been in the hospital and you get discharged to a skilled nursing facility, the government insurance, Medicare, will always cover that. But if you have enough money, the government wants you to pay for it yourself. If you don't have much money, then people can apply for Medicaid, which is the state insurance, and that will pay for things like adult daycares. It'll pay for foster home or expanded care home, but it does not pay for things like assisted living. It does not pay for regular care home level of care. So this is people who don't need very much day-to-day activity assistance. When it comes to something like long-term care insurance, along with Medicaid, it depends on how much help you need as to whether or not they're going to pay for it. So if you need what we call instrumental activities of daily living assistance, so this is like bill paying, cooking, cleaning, long-term care insurance, Medicaid is not going to cover it. But if you need help with 2 or more activities of daily living, bathing, dressing, going to the bathroom, long-term care insurance and Medicaid will cover it. And then again, it's that when do you need assistance? Are you coming from home? Then that's either private pay, Medicaid, or your long-term care insurance. Or if you're coming from the hospital and you've been there 72 hours as an inpatient, then that's when you use your skilled nursing benefit. This is a brand new bill that has just gone through the legislature here, and it got passed, and I haven't heard that anybody's actually been able to use it that I know of. But this is Kapuna caregivers. Basically, it's families can get up to $70 a day to cover things like adult daycare, chore services, home-delivered meals, homemaker services, personal care, respite care, and transportation. And there's qualifications. So the person who is giving care has to work at least 30 hours a week. And then there's all this, you have to be a citizen, you have to be over 60, and it can't be covered by something else like Medicaid. And they can't reside in a long-term care facility. So this is for a family caregiver, basically. And again, this is that activities of daily living, they're going to want 2 or 2 instrumental activities of daily living. Again, this is brand new. I haven't seen anybody actually get this yet, but this is something that we need to be aware of. Hawaii is the first state to pass something like this. This is what more people need. They need financial assistance to keep their loved one at home for as long as they're able to. Okay, so one of the things that was out there was planning for the future about advanced directives. So this is that end of life decisions. This is talking about, do you want to be kept alive on machines? Do you want to be kept alive with tube feeding? And that's something everybody, and including power of attorney, everybody over the age of 18 should have taken care of. I have mine taken care of. Power of attorney for healthcare is probably the most important thing anybody can do, because what you're doing is you're naming somebody that you trust to make medical decisions for you when you're not able to make them for yourself. Best thing you can do. Along that same note, if you want to have that conversation with somebody who you want to name as a power of attorney, go to the website conversationproject.org. It will help you have that conversation. It will help you tell your loved one that you've named as a power of attorney what is important to you, what you want done when you reach the end of your life. There's even a version for people who have dementia. It's a really, really worthwhile website to visit. And then the POLST form is something that you probably saw the big thing outside on the table. It's provider orders for life-sustaining treatment. And this isn't in case of emergency form. This is a form for when people's hearts stop, when people's breathing stop, or when they're very, very ill, what they want done in case of emergency. This is for paramedics, for firemen, for caregivers, to give them guidance as to what they should be doing to honor that person's wishes. Other things to kind of think about: long-term care insurance, we kind of touched base on that. Medicaid for people who have limited finances. And then I've heard it mentioned several times, funeral plans. Having your own funeral planned gives a huge relief of burden to your family members. I absolutely loved this quiz, and I think that this is exactly what every caregiver needs to give themselves pretty much on a daily basis. Am I a good caregiver? Is my loved one safe? Am I trying? Am I doing the best I can? You got it. That's what you need to do. That's all you can do, all any of us can do. You're a good caregiver if you can say you've done these 3 things. And it's these 3 things most of the time, because there are times you're going to go to the other room and scream. Okay. But they're safe, so you got that one still. Okay. This is, I swear, my last slide. I see the timekeeper coming close. Okay, so these are the key points. I've said these before. I won't rehash them, but I want you to know that this is really what's important. These are the things that really matter. And thank you all for coming.
Thank you, Dr. Berry. At this time, I'm At this time, I want to call up our 2 caregivers who are going to be sharing their experience with you, Glenn Nishida and Heather Ho. If you could come up and take the stage. While they're coming up, we had another caregiver who couldn't make it tonight because the person she was caring for had some issues that happened. She did send a paragraph of how she deals with the things that have happened with her. She said, "If there are a few things that I feel a caregiver truly needs to be, are flexible, realistic, and forgiving about the outcome of your loved one's life. Learn to move on and accept the new challenges that develop, especially when their health declines. To be aware that things will certainly change, whether we like it or not. And as much as we'd like to be in control of everything, we can't. As hard as it is to embrace the next phase that your loved one will encounter, remember that the shoulda, coulda, woulda are a thing of the past. Feeling guilty or wallowing in self-pity does not resolve anything. Give yourself a hug, knowing that you did the best that you could for your loved one, and even if it was never spoken, that they appreciated all that you did for them. Most of all, know that around the corner, there is a light at the end of the tunnel for everyone." That was from Amy, who would have been here tonight but could not make it. At this time, I'd like to introduce our caregivers who could make it this evening. Heather Ho, right here. Let's give her a warm round of applause. She retired 11 years ago to become a full-time live-in caregiver for both her mom and her dad. Her mom had Parkinson's disease, and unfortunately, she recently passed away this year. Heather is currently a caregiver for her dad, who has diabetes and dementia. We also have Glenn Nishida, who is a caregiver. He actually spoke at our last year's Alzheimer's lecture. He has a Queens connection as well. He is a former anesthesia technologist here. He later started a medical supply business in 2001, and he retired in 2015 to care for his uncle who has dementia. So we're going to start with Heather Ho, who is going to do the PowerPoint from her location there.
It's very important for caregivers to take care of themselves as well as their loved ones. Today I'm going to go over support tips and how I manage frustration and stress. For the support, the Queens Geriatrics Department has been a tremendous help for my family and my parents. They know exactly how to take care of them and guide us through the daily burdens that we bear. And they stop becoming burdens because of their guidance. For those of you who have loved ones who have served in the military, the Veterans Administration has a GEM program. It's a Geriatric Evaluation Management Program. And my father was in the military, and we did enroll him in that program. And they have a team approach. They provide you with a geriatrician, a geriatric psychiatrist, a nurse, and a social worker. And it's provided a lot of help for us also. And they also have very good equipment, supplies for you. And they know exactly what you need. There's also the city, Honolulu City and County. They have the Senior Information and Assistance Handbook that the American Savings Banks distributes. I think it's every 2 years, and that has a wealth of information also. And then there's your own geriatrician who can provide you with some guidance. There's also friends and relatives who, it's quite amazing. I found out they are always there for you, and you need to reach out to them, but they are willing to provide the support that you need. And other physicians also, when you share, they will also give you tips, because they also go beyond what their specialties are. And everything cross connects. So they are a tremendous help also. So share what you're feeling and the problems you have. And social workers, they are a deep resource for help. I recently just found that out. They can use their tools to help in your situation. But this means that you have to share your experiences so everyone can benefit, and they will know what you need. If you don't share, then you may not be able to reap the support of many. Routines. Routines are very important for your loved one as well as yourself. You need to be able to rely on a certain type of care, a certain type of menu, and it's okay to implement these routines, and people will understand that you do that. Medication needs to be given on a routine basis, and meals. And as Dr. Barry discussed, my dad had some comfort foods, so he actually is pretty famous with all his doctors, because I always had that in case he became agitated. You need to find out what triggers them and how you can resolve those problems. And you can incorporate strategies to prevent problems. At home, I keep a folder. It has a list of their medication, a list of their doctors, their post, their copies of IDs, their medical history, and insurance, copies of insurance. And if there's an emergency, when the ambulance comes, which also brings the firemen, you have it all there. You will have a million questions asked you. And at the time that it happens, your head is going everywhere. But in our case, the fire chief actually goes and gets the folder himself, and he has all of the information. I was actually shocked, but he came to our apartment a couple of times, and he started answering the questions for me. And another strategy for me was when I first stopped working, to just find out what was going on with my dad. And it turned out to be an 11-year job. My dad told me, well, if you're not working, you can take us out for every meal. And I said, sure, I can. And he was a homebody. So for him to volunteer to go out was amazing. So I told my mom, if you want to go out for every meal, let's do it. We ended up usually at Kenny's. And on that table, there was a container with packets of sugar. Oh, my goodness. That first day, his hand went in, he took all the packets out and stuffed it in his pants pocket. My mom was appalled. She was so upset. I was upset also. And I told my dad, Dad, you can't do that. And he said, why can't I do that? He was so upset at me. And so we struck a bargain. He can keep 3 of them, and I put the rest back. But I knew that I had a problem. Every day that would happen. So I thought about it in the night, and I strategized, and the next morning I told my mom, Mom, you go to the table first, and take the container and put it on the seat, out of Dad's view and out of his reach. She did that. And no problem at all. Problem solved. Until we went to the ramen for lunch. And then there was the chopsticks and the napkins on the table. She looked at me and I said, yep, take them away. And so that, you get inventive on what to do. Know what problems you will face and try to figure out something else that will resolve the situation without having a confrontation. And also coaching. When my dad started losing his memory, he absolutely did not want to go out. And I couldn't figure it out because he was having a good time going out for every meal. And I realized he didn't want to go out when people were joining us. And then I realized that he didn't want people to ask him questions because he may not know the answer. And he also may not know who they were. So he was embarrassed. And so then I found out that I needed to coach my dad. I would start from the night before to tell him, we're going out with Jerry. He's your sister, Auntie Eva's son. Do you remember Auntie Eva? He would say yes. And so I said, we're going out with her son tomorrow. I would continue that in the morning until we went out several times during the day. And then I called my cousin up. And I said, Jerry, my dad, he's having a hard time with his memory. So when we go out, just say hello. Don't have to chit-chat with him and question him because he's okay, but he may not know the answer, and then he'll become uncomfortable. So chit-chat with my mom and I, because my mom remembered everything. And read nutrition labels to provide a healthy meal for your loved ones. And nutrition labels, I found out, once you start reading them, you really realize what ingredients are in different foods and how one piece of bread can be so different from another piece of bread. So that's a really good tip, especially if your loved one has health problems like diabetes or high blood pressure. And again, rely on your family and friends for support. They are there to help you, and they are willing to help you. Prioritize and simplify. Your life will change as a caregiver. No longer will your priorities be going out with friends. Your family becomes the focus, and their health becomes the focus. And with that, you need to simplify. You don't need to cook gourmet meals. It's okay to eat leftovers the next day or to freeze for that day when you don't want to cook. You don't have to be Superman and Superwoman. Know your limitations. If you cannot take them out for the all-day event, then decline it. Or find a way where you can. So you need to adjust the way you react to invitations and going out with people according to how your loved one will react to the situation also. And use the local drugstores. They are now, I've noticed, carrying a lot more aids for the elderly. And also the local health specialty stores. I'm not sure if too many people know about them, but I went into Dotterman a couple of months ago, and they've totally changed. They have all types of wound care, and they have so many different devices that you can use for your loved one. And maybe about 2 years ago, they didn't have that section. And then, of course, there's the internet. Amazon.com will deliver to you, but you have to make sure for them on whether they'll charge for shipping. Shipping can be more than the item when it comes to Hawaii. But it is, a lot of things are available on the internet. And we found about a year ago, it's called Best Buy Medical Supplies Limited. They will ship free to Hawaii if you purchase over $99. And now I'm totally for it. All the diapers gets sent directly to the house. I don't have to make the Costco trips for the Depends, and they're just as good. So, and it also depends upon how your loved one is, how much time you need to spend with them. As my father declined, then I couldn't go out as much. So ordering from the internet was easier for me. But you also, again, you need to share your experiences. It really does take a community to care for children and the elderly. And if you don't share, people won't know that you need the help. So don't be afraid to share. For frustrations, it could be unexpected routine changes. new medicines that conflict with the existing medicines. So you have to change the schedule on how you give your medication. Or a guest who comes and doesn't understand why you do the things that you do. And basically, in my case, everything that I do, there's a reason why I do it. It's not because I want to do it. And one of my caregivers who we first got her about 2 years ago, I told her, we do certain things. Don't ask me the reason why, because sometimes I forget why. But there's a reason behind why we do everything, and it helps me. It makes it a lot easier. About 9 months later, she said, Heather, you don't even have to tell me the reasons behind why, because it does make it it does make it easier. I can see. And so that unexpected routine changes can be a frustration for you. Also, finding the correct equipment to help your loved one and to make it easier for you and them, that can also be a frustration. And strange new habits. What could that be? Well, the best one that I can think of is my father started insisting on using the shopping cart. And I used to tell him, Dad, we're only going in for one item. We don't need a shopping cart. And he said, no, I need the shopping cart. In hindsight, I realized that he needed the shopping cart, probably because he was getting a little wobbly, and he used the shopping cart as his walker. But he didn't want to admit that he needed any devices. And so we would, I would say, okay, we can take the shopping cart in, but let me push it. You don't need to push it. And we would argue about it. But in hindsight, I'm like, should have given him the shopping cart. But that would have been a tip to me. So if they insist on new types, something that is out of the ordinary, think about it and look at why they're insisting on it. It could be a tip to you on how they're changing. And a lot of times they don't want to admit that they're not remembering or they're having a hard time walking. So that can lead to a frustration, but think about it. And how do you get rid of all this stress? The first thing that I do is think positively. And I always think that there's always someone else who has it worse off than me. We tend to feel sorry for ourselves, but if we look at other people and the struggles that they have, then you can find the strength in the situation that you're in. And don't take things personally. There will be times when words are said or things are done, and they really don't know what they're saying or doing. My dad once kicked me out of the house, and I left. Of course, I made sure that they had their morning breakfast and lunch and medicine. My mom could take care of that. And the next morning, my dad woke up and told my mom, Heather stayed out the whole night. What happened? She didn't come home. And she knows she's supposed to take us for breakfast. And she looked at him and said, you kicked her out last night. And he said, why would I do that? she takes care of us. We need to eat breakfast. And she said, you kicked her out, so she left. And my sister happened to call at that same time. And he told my mom, give me the phone. And he said, where are you? And my sister said, I'm in California, Dad. And he said, oh, wrong one. I don't want to talk to you. And my sister called me up and said, Dad's looking for you. And I said, okay, well, let me, I have to think about what's happening. And they're prepared for breakfast and lunch. Mom knows everything. And I came home at dinner. Dad was there. Thank God you're here, and he was happy. He didn't remember that he kicked me out. He's also said things, but in 10 minutes, it'll go away. Don't personalize it. They really don't mean what they're saying. And they, at the moment, it's hurtful, but you just have to understand that it's not really them. They really don't know what they're talking about. And in 10 minutes, it'll go away. And especially later on when my dad had short-term memory loss, so much easier. I had one with short-term memory loss and one with the memory of an elephant. So I could think about what is better. But another way for stress is food. That's my ultimate goal. I love to, if I'm stressed out, then everyone knows and says, okay, we'll bring you ice cream or we'll bring you food from your favorite restaurant. And that's a good outlet also. And the massage. One day, I was talking about my aching shoulders, and my dad's caregiver said, sit down, stuck her elbow in my shoulder, and I was screaming, oh, it's so sore. And she said, that's okay. No pain, no gain. She did it 3 times to me. The next day I told her, wow, it was wonderful. No more pain for maybe another 9 months when probably it all accumulated again. Text or email venting. All my friends know. I give them a warning. I'm venting, and I just tell them my frustrations. They don't even answer me. They just know that that's me just letting off my steam. And they sometimes, they'll say, oh boy. But usually, they have their life too. They don't answer me, and I just say thank you. And that has been a real help for me. Or having a night out, going to the movies or dining. For me, I like to go solo because I was caring for 2 people. So I always had to think about what everyone wanted. So for me to go out to eat alone or to the movies alone, that was the best for me because I could only focus on myself and what I wanted. And enjoy nature. This one I would do with my parents. Either Christmas or New Year's, I would pack them up and we would go around the island. My mom, she was born in Waimea Valley, so she loved the North Shore. We would stop at all the beaches, look at the surf, take some snacks, she loved shrimp, go to the shrimp shack, and one shack had fish, so my dad could eat the fish. And it was completely relaxing for all of us. Or, sometimes we would pick up lunch and go out and watch the waves at Diamond Head. So take them out for nature. That is one stress relief that was also for them and not only for me. We all enjoyed it. And then again, share your experience so everyone can benefit. You will become the supporter that lends a helping hand, ear, or smile later to all of those who help to support you also. And what did I learn from what I've gone through? Contact a geriatrician. It makes the world of difference. They understand the aging process, and the experience is unique and comforting for both the patient and the caregiver. When we had our problems, and I really did not know what to do, Queens discharged my dad and said it's just dementia. I found Dr. Barry, and she said, don't worry. Your life you will be able to sleep soundly at night in about 4 days. And she gave my dad some medication, and wow, it worked. So the geriatrician, and let me tell you this one story, sorry. When I got the form to fill out for the geriatrician.
Sorry, I think it's 11 pages.
Yeah, I was gonna say, I think it's 11
pages. Yeah.
Long. And my dad doesn't like to wait, so I requested that they will pick it up so I can fill out the form. And when I was going over that form, I was like, they can ask them if they're deaf in what ear, and they can do this. And when we got to the appointment, I realized why they asked those questions. My mom couldn't hear in her left ear. Oh no, sorry, right ear. So Dr. Barry went around to her left side and spoke into her left ear without making her uncomfortable. And my mom didn't have to say, I didn't hear you. And so then I was like, wow, this is a new way of being a doctor. She completely put everyone at ease. And so that was my lesson learned from taking care of my parents, was contact the geriatrician, and they can help you through the aging process. Without their advice, it would have been a lot harder for my family.
Okay, thank you, Heather.
And thank you. That was
you
very
much.
kind.
And now we're going to have Glenn, who's going to come up to the podium to speak.
Okay, this is a good time to tell you that they're better at PowerPoint presentations than I am.
No way.
Yeah.
That was so fancy.
Yes, exactly.
And Heather, so I gotta apologize to you because I don't read nutrition labels. Hello and welcome everybody. I'd like to thank the Queens Medical Center, Dr. Barry, Lisa, for having me here this evening. I'm going to share a story that pertains to me. It's about my uncle. And of course, we're all here for caregiver stress. So how many of you feel like that match? At the end of the day, right? Burnt out, head down, just want to go sleep. But caregiver stress is real, and it's all the way how you approach it that makes all the difference in the world. So my story started with my Uncle Eddie. Here's my Uncle Eddie at age 58, single, never married, no kids. My story started one day where his physician called me up and said, hey, Uncle didn't show up for his appointment. And knowing my uncle, he's the most prompt person I know. I mean, all his clocks in his home is set 15 minutes fast. So he's never late for anything. So that was kind of a concern. Make a long story short, he was in his car for 8 hours. He got into his car to go to the appointment, and he forgot where he was going. And for 8 hours, he sat in his car. So we got a call from his neighbor, and so my wife and I drove down and got to his house. It was pretty dark, and we knocked on the door, and my uncle came out, and he looked like that. Emaciated, dirty, he was confused, and my wife and I both were really shocked. We're like, oh, what's going on with Uncle? Made an appointment with his geriatrician, took him in, and they immediately admitted him to Queens Medical Center. We spent about 30 days in the hospital for malnutrition. He got discharged to a rehab facility, and upon discharge from there, it was my wife and I's decision, since we have an empty house now, our kids are grown, that he'd come live with us. So in 6 months, Uncle's physical appearance started to change. He got a little bit better, he got healthier, he was happier. And this is my uncle today, age 85. Doing much better. His physical, okay. No. It's a team effort. So Uncle physically is a lot better, but he has a 10-second memory. So his dementia is pretty advanced, you know. Even though he has a bad memory, we take him out on outings like this. I take him to the pool, and it's surprising, you know, he can fight you tooth and nail. I don't want to go. Why do I got to wear this shirt? But once he's there, he lives in the moment. Now, there's nothing more frustrating than making a meal for somebody and placing it in front of them. Well, I don't want that. I'm full. I'm not going to eat that. Ooh, I don't want this. Right? Uncle's that way. The dementia tells him he's not hungry. No matter how much I give or what I do, he just doesn't want to eat. So I got to come up with creative ways like this, so he's happy, like making little hot dogs into squids, right? And it works. Actually, it works. It works sometimes, but lately the portion control. I put food in front of him, and it's like, I don't want that's too much. So my wife and I, we put small portions on his plate. He'll eat it. Somebody will distract him, and we'll put some more. So you start off with like a quarter cup of food. So it's like, oh, I can eat that. And then my wife will go, who's that, Uncle? And I'll put some more on his plate. And we'll do it like 3 or 4 times. So then he have a regular serving, but he won't remember. So those things work for me. But the frustration of not knowing. I mean, I took him out here, and he told me, where am I? You know? Is that New York City? Because he saw the Aloha Tower, and he said, is that the Empire State Building? I go, oh, no, Uncle, we're in Honolulu. You know, I don't know where I am. So he's constantly not knowing where he's at. He's lost. And I think being in that state for a long time causes him to be frustrated. I said, no. I'm trying to get him up to go to daycare. And this hasn't been a problem with us. And like, no, I think because this is the last thing that he has control over. He doesn't know where he's at most of the time, but he has control over yes and no. And so we got to kind of bargain with him, you know. And I think it all depends how you word it too. Uncle, let's go. No, I don't want to go. Uncle, you got to go. We got to go daycare. No. Right? Or if you go, Uncle, you know what? You got to finish that project. What project? Well, you're the lead man. They need you to finish that project at daycare. Oh, okay. Let's go. Right? So it's like redirection. But of course, being frustrated, there's times when you have outbursts like this. When he gets frustrated, he'll slam the table, spill his cereal, you know, because he doesn't know. And I think that's with people with dementia. That's the biggest thing. They're constantly frustrated because they don't know what's going on. Things that help him. Journaling helps him. Coloring helps him. Word games help him. But it's kind of, you know, if you look at his penmanship, he has beautiful penmanship. And they live in the moment. He can still write. He can still express what he's feeling. But sometimes when you read what he says, like that word in focus says hopeless. He says, I feel hopeless. I don't know what to do. And it can kind of be heart-wrenching. But he expresses it on the paper, and then when we go over, we read it together. And I think it kind of gives him an idea of where he's at. I empathize with my uncle. So we came up with this, junk, yeah? So every time he tells me, I don't know, why am I here? I know Uncle Junk. And he goes, yeah, Junk is right. So if you empathize with him, it makes him feel better. It makes him understand, well, there's somebody that understands what I'm going through. Redirection. Now you heard this from Dr. Barry and Heather. Redirection is so important, And this is an example. Uncle, let's go walking. Nope. Come on, you got to go walking. No, I don't want to go. I'll leave the room, come back. Hey, Uncle, you want to help me walk my dog? Oh, yeah. Okay, we go. Right? So just different phrase. How you phrase your sentences to your loved ones. It makes a huge difference. I try to eliminate words and phrases like this. The first word, remember, that was the hardest thing for me to not say. It took me like a year. Because when he first came, you don't remember, Uncle. I just told you, right? Why come you cannot remember? It's so frustrating. But once you learn to not say these words or these phrases, it makes your life so much easier. The third to the last, I heard this at Costco. This poor mom's trying to feed her, this poor lady's trying to feed her mom. You have to eat it, you're going to die. And I was like, whoa, okay. I didn't want to say anything, but I was like, oh, she was so frustrated. You don't eat that, you go to hospital. Wow. These things, they make them feel, it takes their dignity away. So I really try and not use these phrases. It's really difficult, but once you get the hang of it, it becomes second nature. I try to think outside the box. My uncle, and I don't know who out here have trouble getting your loved ones to take a bath. I don't know what's with, like for my uncle, that was their biggest thing. I don't want to take a bath, I took a bath already. So I started with putting Post-its note on the soap. Like, Uncle, you never take a bath, the Post-it note is here. Oh, okay, so he takes a bath, right? Next day, same thing. I took a bath. No, the Post-it note's still there. By the end of the week, I caught him peeling it off, putting it in the trash. So that didn't work. It didn't. It worked, lasted about a week. So now I kind of make him feel like he has a privileged life. I told him, yeah, Uncle, oh man, you got a good life, man. You got to go home, bocha, which is take a bath for non-Japanese people. Drink coffee, watch TV, and you can go sleep. I got to go home, cook dinner, wash it, then go sleep. You want to help me? Nope. I go, you lucky? Yeah, lucky. And that has been working for how long now, Joan? A while, right? I mean, it's been working. So I make him feel privileged. Of course, I got to repeat it like 20 times. But by the time I get home, he's ready to take a bath. So it made my life a lot easier. And lastly, just answer the questions. No matter how much time they ask you just have to answer the questions because they don't remember. Like for my uncle, his memory is literally 10 seconds. 10 seconds. It's fascinating. If you notice in his hand, he has a piece of paper. It's actually a note. I have on the note, Uncle, we're going to daycare. Social Security and VA pays for your daycare. Glenn's taking you daycare. Today is whatever the date is. I'll start this video for you. And this is a single car ride from my home to Ivaley, which takes about 35 minutes with traffic. One of the hardest things to learn, just answer their questions.
I don't know where we're going.
We're going daycare.
But I can't afford daycare.
You can afford daycare. Where am I going?
Yeah.
Daycare.
But I can't afford daycare.
Oh yeah, you have Social Security.
I don't know where you're going now.
You don't know where I'm going. We're going daycare.
I can't afford daycare. Who pays for daycare?
You do?
I have no money.
You have your Social Security.
Okay. Is that enough?
Uh-huh. Yeah, if it wasn't enough, you wouldn't be able to go, yeah?
Yeah, okay. Where are we going?
Where we're going? We're going daycare.
Who pays for it?
You 48 times in a 30-minute ride. I kid you not. 48 times. But once you learn just to answer the questions because they don't remember, it's going to make your life so much easier. You know, you just say, oh, you know, where are we going for dinner? Or what time's dinner? But you can also have some fun, you know, because being a caregiver is a very stressful job. And like with my mother-in-law, she would say, Glenn, what time's dinner? Oh, 5:30, Grandma. Really? Okay. She'll call me back. You know, 15 minutes later. What time dinner? Grandma, 5:30. Oh, okay. She called like a third time. Grandma, 5:30. By the fourth time. Glenn, what time dinner? You ate already. She said, what? I go, we left already. I'm home. How come I'm still hungry? You know, but I got to because it's, I know it's mean, you know, don't judge, but, you know, you got to find some humor, like Dr. Berry said, find some humor in something, you know. So with that, I want to thank you all for having me here, and I want to let Uncle say a little few words to you.
Good hands.
You want to say like hello or anything to the people?
Aloha.
Aloha. Aloha. What does aloha mean?
Means anything. Hello, goodbye. Aloha means I love you.
Oh, wow, that's cool.
So aloha, ladies and gentlemen. Thank you so much.
Thank you so much, Glenn. It is 7 o'clock, so I know some of you have to go. You can take your time to leave now. We do have our question and answer period going on. If you have a question, please raise your hand and we'll come to you. Any questions? It's always the first one that never comes up, and then once the floodgates open with that first one. Who wants to be the first one? Ah, very good. You'll get the prize afterwards.
My question is regarding the Veterans Administration.
Yes.
Does that limited only to wartime veterans, or does that also for Army retirees?
Think you will find that it depends upon, yes, what war you're in. But my father did not retire. If you retire, you get a lot more benefits. But he was in World War II. And they provide a lot of benefits. So, and what I found, the person who actually took the application tried to dissuade us from going there. You know, he said, well, my father didn't qualify monetarily, so we would have to pay a co-charge. And I told them, that's okay. You know, we have our second, another point of view. So I said, that's fine. We'll pay the co-charge. And they said, but what insurance do you have? He has federal insurance. So you pay zero now, right? Yes. And I said, wow, care is so much better out there. You should just stick with them. And I said, well, we just want that second opinion, you know. Who knows when we're going to have a crisis? And this was 9 months before we had a crisis. And it took a while to get something. When we had the crisis, I insisted that he enroll. And so he finally accepted it. When we had the crisis, then I told my sister, find a geriatrician. You know, luckily, when we went to the hospital and they released him with dementia, they had recommended the Queen's Geriatric, which I think might have just opened within a couple of years. And she called the VA and said, my sister has been waiting 9 months. So they did give us a appointment, and they recommended us to the GEM program. But
Does your dad have service connection? Because the big question with the VA is how much percentage people are service connected when it comes to how much what benefits they get from the VA?
Right.
Yeah. Do you know if he's service connected?
No, I don't.
Okay.
I just gave them all the forms
Because
they
it's
asked for.
not necessarily that you served in a war, but you do get more benefits if you are more service connected. So you have had more injury or more illness or more disability because of something that happened to you in the military.
There's also companies out there, private companies, that can help you get funding from the VA. So I think my wife contacted somebody, and they did the whole process for us. So we paid a fee. I think it was like $1,200, but they did all the running around for us.
Does geriatric services extend to the spouse as well?
For VA?
For VA.
I think the medication benefits do. I don't know outside of medication benefits.
For my father, it didn't. But there are, if someone gets injured while serving, there's something called TRICARE, and in certain instances, spouses are eligible for that.
Okay, thank you. Any question? Oh, a question there.
Hi, I have a question for Dr. Barry. Are you accepting new patients?
That's the question of the evening.
Queens Geriatrics are accepting new consultation patients. So we're not taking on new primary care patients, but we are seeing new patients as consultants.
Anyone else? Wow, okay.
Yeah.
Everyone just wants to go home.
I think everybody has been waiting for that bar to open in POB3 so they can all just leave for free.
Or the information was so fantastic, you've left them speechless. Let's give them all a big round of applause.
Thank you.
Dr. Jessica Barry, Heather Ho, and Glenn Nishida. And you know, Dr. Barry was talking about music. Well, now someone wants to get one after I just said that. Okay, we have one more question in the back.
I was wondering if there is anyone that is a caregiver in the audience, or you know of someone that has the Lewy bodies dementia. I'm looking to find a support group or starting a group. If there's anyone going through that, it's quite a bit different from Alzheimer's because you have, my partner has hallucinations every night, and that's something to deal with because he's fairly normal in the day, so you know, day care is out unless there's night care somewhere. That's what I'm looking for.
The question is about caregiving support groups for Lewy body dementia, and I'm not aware of any locally. I would actually probably start with the Alzheimer's Association and see if they have any suggestions. You might even find in the Alzheimer's Association support groups, there's other caregivers of people who have Lewy body disease. And they may know that. They may say, oh, the Thursday night at Central Union, and I'm just completely making that up. I don't know when the Central Union one is. Okay. I would call the office too to see, because you may want to talk to one of like the social workers or coordinators there. They probably have a much better idea because they're the ones who run the support groups.
Okay, and I wanted to add, you know, Dr. Barry mentioned how music had like this change effect on one of the patients that she worked on. When I was, for 12 years now, I've been singing at different like nursing homes and care places. And I was at Kuakini, and they have a population of Japanese patients. And I'd play American music first with my ukulele, and we're doing a sing-along. This woman in the front, totally just as if she's not there, not listening, not moving, just completely zoned out. And then when I started doing a Japanese song called Yu Yake Koyake, which is a children's song in Japanese, she changed. She came alive. She started moving. She started singing the words, word for word. And it was amazing to see that connection that music has. It might not work for everyone, but if it does, and if you could find that music that your parents enjoyed and maybe they sang it and you listened to it growing up, you could sing with them. That's another, I think, connection that both of you can have and find some relief that way. That's just my 2 cents. Okay, and I want to say mahalo to Lynn Moku from the Alzheimer's Association Aloha chapter who is out there. We also had from the Queens Geriatrics Department, Valisa Saunders and Dr. Britta Aramaki. If you want to know about advanced care planning, we have a coordinator here at Queens. Her name is Lori Protzman, and you can talk to her and reach her at 691-7716. Also want to say mahalo to our volunteers this evening, James, Laura, and Anthony. Let's give them a round of applause for spending their Wednesday evening with us. Next month, our lecture is going to be on seizures, what's happening, what can be done. Maybe you started to shake, had body twitching, became unresponsive or blacked out. There are different kinds and types of seizures, so you're going to find out more with Dr. Victoria Wong, who is a neurologist and epileptologist here at the Queens Neuroscience Institute Comprehensive Epilepsy Center. That's Wednesday, October 25th, 2017, 6 to 7 p.m. at the Queens Conference Center. You can register online at queens.org, click attend the class, or call our Queens referral line. That's it for this evening. Don't forget your parking tickets to get them validated and turn in your evaluation forms. On behalf of Queens, thank you all for coming. Drive safe and have a good night.